Blake here with Asha Daya, Portia Coleman, and Kristen Brockman. Joining us today is one of the most trusted and recognizable plastic surgeons in the world. I mean, I am honored here. You've seen him on CNN, Access Hollywood, Extra, Larry King, and featured in Vogue, GQ, and In Style. This doctor got it going on, okay? Please give a warm welcome to Dr. Randal Haworth.
Yes, take it all in.
Take it all in.
Take it all in.
So what are you going to do to us today?
Well, that was quick, Kristen. I mean, let him breathe.
Yeah, that's all
Away with the formalities.
I was ready for a procedure. Okay, next time. So, how are you?
I'm doing very well, thank you. And thank you for having me on this wonderful show.
Of course.
Bite-sized TV.
Yes.
Yep.
How does it happen when someone approaches you and they want to get a procedure done? What do they usually ask for? What do you tell them?
Well, it depends, because sometimes you have to look at their psychology. Sometimes people just want to have affirmation that they're beautiful.
Right.
And so I look at them and they say, what do I need? And I say, actually, you need nothing. Because
Really?
I
So you
say
turn people away?
Oh, so many times now, because that's the best decision I made in the last 8 years, was actually we're turning down a lot more people, because I think a lot more people have unrealistic expectations. You know, whether it's the selfie craze and the HD and all of this, so people are just becoming so narcissistic, so obsessed. And a lot of times they don't understand that plastic surgery is a really serious business. And so it's all about instilling realistic expectations into what they are seeking. But some people really need it and they really want it, and you know, they're very happy with themselves, they love themselves, but they just don't love their jowls.
Right.
Well, how do you feel about young women, you know, looking to getting plastic surgery at such an early age when their skin is still really firm and beautiful? Like, what do you say to that?
Well, you know, the best results are obtained in those who need it the least. So a lot of times if somebody is not happy with their nose, that nose is not going to get better or grow into your nose. I mean, if they really dislike their nose and they are, for example, headed onto a you know, a movie star career or singing career, it's better to get it done under the radar and avoid a Jennifer Lawrence syndrome, where, you know, people already recognize her and then she gets a nose job.
Wait, did she get a nose job?
Jennifer Lawrence, wasn't she?
Really?
No, not Jennifer Lawrence.
Oh,
no, who's that one on the
Aniston?
Ashley
no,
Tisdale?
the one Dirty Dancing girl.
Jennifer Beals!
Jennifer
Everybody's getting it wrong.
Okay, let's get
All
our Jennifers
kinds
together.
of Hollywood.
Rumors.
A lot of Jens.
Yes, Jennifer Grey.
Jennifer Grey.
Yeah.
It's a Jen, I know that.
But what's interesting is that certain features actually make your career. Like you said, with her, even though her nose she might not have liked, it was really distinctive for her. And all of a sudden, you seem like her career kind of fell off because she didn't keep that look.
Beauty is strategic imperfection, and it's all about the attitude and embracing what you have. But if you have, if you feel not very confident about a certain facial feature, come on, we've all had as teenagers too bad skin days. I mean, how often you didn't even want to go out because you've had pimples and so on. I mean, it affects your whole psyche.
Every day, and you see things that like most people don't even realize.
Last week, it was really bad. I'm just saying.
They haven't, even Broomies have it.
Speaking of celebrity plastic surgery, we're actually going to go through a couple of what we might call
Tragedies?
over the top or excessive plastic surgeries.
Yes.
Let's take a look and we'll see what you think, okay?
So,
Okay. Well, Heidi Montag's been very open about her surgery. She had multiple procedures in one day. Is that something you would do? I think she had 10 procedures.
Yeah, well, you have to qualify it, though, because let's say you had 500 procedures, but what type of procedures? Everybody gasped, but they're just like little skin tags.
Right.
yeah.
Okay.
So you have to qualify it, and but I think in this case, this is one classic example where, despite the plastic surgery being technically well done, you have to step back and always understand you can't paint too close. You have to get perspective. She looks older.
Yeah,
She does.
You know?
I don't think she looks good now.
No, well, it's,
better
you know,
before.
she looks sort of generic now,
Yeah.
but when they, for example, one of the big things that really changed here was the chin.
Yes.
And her chin is long, and all they did was
Makes it look square, doesn't
they
it?
chopped it off instead of shaping it into a V and keeping that sort of
Natural.
feminine V
Feminine
look.
looks masculine.
Should have
the way
gone
they
to
have it
Dr.
now.
Haworth, Heidi.
Well,
Who do we have next?
this is our favorite. What do you think about Miss Lil Kim?
She just had a
Lord.
baby, right?
Well, thank God, baby's not gonna look like that.
Zinga.
I'm sorry. Oh, I'm sorry.
Well, which is before and after here.
This one. The one with the lips.
Before is on the left, and after is on the right.
I mean, honestly, a lot of it depends. I mean, I've seen other pictures of her where there was a clear, distinct before and after.
Right.
And I just think that she had overly aggressive rhinoplasty that didn't respect her ethnicity. Right. And so then they get that pinch look like Michael Jackson did. And it's like a whole family trait. So, you know, I think, thank God that people are starting to change it. It's also not just for aesthetic reasons where you start to look fake, but also functional, because if you just start to get pinched tip, you can't breathe through your nose, et cetera, et cetera.
What do we have next?
Well, Miss Janice Dickinson really
example.
just.
I saw her this weekend. She looked like she was melting.
I think this is a classic case of just too much, too tight, just too much plastic surgery.
She
And
looks like the Joker right through here. Like the lines that are like when she smiles, it's like a fixed. It's bad.
She
like,
feels tight.
Yeah,
And you know what happens when they get too much filler around their cheeks?
Yeah.
I call them cougar cheeks. Their eyes start disappearing.
Is that what's doing it?
Yeah, their
made
eyes
for
start
it.
going smaller and smaller. Hello, is anybody in there?
Yeah.
And that's that look.
Wow.
I
Okay.
noticed a lot of
Next.
women do look.
So speaking of eyes that are a little tight and squinty, we have Mickey Rourke.
See, guys do it too.
He was so hot.
He was a hottie.
That, oh my good. And look at the lip. Didn't he get like some lip injection? What is going on?
No, he had Gore-Tex put in his lips before.
What's Gore-Tex?
What
Oh,
is
that was a long time ago. That was, it's an artificial material, and they use it for various, parkas and so on, but it's also used in medicine. It's actually safe, but certain things in the lips aren't good. So he had that done. I think he got seduced by the craze when people were getting plastic surgery. And this is a guy who's good looking. You're 100% right.
He was hot.
Great
And his
actor.
eyes are
tragic.
different shapes now, too.
Well, and then this is what happens when men get overly aggressive eyes. I'm very careful about doing the eyes because it can over-feminize them.
We got one last one.
Okay. How about Meg Ryan?
Miss Meg
Look how pretty she was in the lab.
She's not that bad.
But look how much it
You're
aged her, like he said.
lips.
Like when they get
Those
something
lips.
done.
The lips are just, again, it's like putting 22-inch wheels on a Volkswagen Bug.
Yeah.
It's just
do you
way
do
too
lips?
much.
Do you do
I do.
lips?
I do more lip reshaping procedures than anybody in the
you
world. So
serious?
it's upper lip,
Wow.
lift corner, but it's not volumizing.
Yeah,
so it's
what's
like
the trick to making it not look like, hey, you had your lips
getting
out?
the shape right first. And I don't even address volume, not filler or anything. And once the shape is good, then you can add filler.
you can add
so
filler.
then it's like adding making sure the foundation's good before you build your house.
Okay,
Wow.
that makes sense.
Well-
All right, well, before we go, we want to definitely talk about your product that you brought us, Biochemistry. And tell us, this is a Heal No Pain foot spray. How did you come up with this?
Well, in a nutshell, it started when I was on the Swan TV show, and all these women had never been on high heels or wobbling and pain. And then later on in my practice, everybody's complaining, saying, God, I can't stand these heels. Is there anything to do? I was injecting filler to no avail. So finally I said, hey, listen, the answer may be in my clinic.
Filler in the foot.
Filler in the foot.
Wow.
Who knew?
Mixed results. So we did, I started to modify lidocaine, which dentists and doctors use to inject. And so I said, let's do it in such a way it gets absorbed through the thick foot of the thick skin of the foot. And you spray it on. 10 minutes later, it basically numbs the pain and not the foot. Wow. And we have found that this has been really well received. Blind testing. I always encourage people to try the 1 foot challenge. Spray 1 foot and not the other.
I'm gonna
Wait
do
10
that.
minutes, and then you notice the difference.
This is perfect for like Emmys, Oscars, celebrities.
Yeah,
putting
exactly.
their
Going to
crotch on the
Vegas,
carpet.
wearing
Yeah.
heels.
And what's
We
the
just got-
website, too, so we can...
It's healnopain.com.
HealNoPain.com.
genius.
That is
I love that.
absolutely...
Thank you.
Heal No Pain.
Pain.com. And we're getting a repackage too because we're
Stepping
starting
things
out.
like that.
Yeah.
So I'm pretty sure it's in demand during award season.
Yo, big time. I mean,
Anytime when you're a lady.
We're all sitting in here.
Portia,
so
we've seen
you
your
did.
shoes.
Yeah, my shoes, they hurt. They're painful. But
you should have done a spray now.
I'm gonna do it now.
Here we
Oh,
go.
she's gonna try it now. But
here we go.
while we're testing it out,
Dirty.
stick
Don't
around. We've got a
touch
True
my
Blood
face.
Sucking Honey, Amelia Rose Blair, joining us for some vampirish
Where else?
fun when we return to the girl spot on Bite Size TV as she gets her feet up.